Yep. हाँ हेलो। क्या चीज?
और कौन कौन लोग भागे मतलब करने में किनको किनको राजी होती है।
नहीं, रामदेव तो नहीं बोले हैं। एक के गुप्ता को भी बोले हैं। और अभी देखिए, बोले कि ज्वाइन करते हैं।
Hello, Dr. Sahani.
Yeah,
Good evening, sir. Thank you. Sorry. Yes,
you are in time, sir. No, not late.
early today for me, but
People are now joining, still joining.
I'm glad we were able to join. And you're coming. It's 7 p.m. there.
7 p.m. Indian time. Yeah.
Yeah.
What's your time now, sir?
8:30 because I'm in Central Time in Texas, in the U.S.
Yeah.
So that's.
Our Secretary General has joined, and our
yes. Good evening, Dr. Bekker.
Good evening, sir.
Good evening, and Dr.
How
SANJIV.
are you?
Dr. SANJIV also has joined.
Dr. Gupta?
Yeah.
Dr. Gupta,
how are you?
How are you, sir? And I'm doing fine. I'm doing fine.
You are well in time, sir. You are well in time, sir.
Nice to meet you, sir.
Yeah.
Nice to meet you. So,
good evening, Dr. Alex. This is Dr. Sanjeev from Patna,
Dr.
India.
Sanjeev? Yes.
Dr. SANJIV is the secretary of the seminar committee.
Secretary of the yes, sir.
Hi, Dr. Sanjeev. How are you?
Hello.
Good evening, sir. I'm fine.
Good evening. How are you doing? Fine, very nice.
Fine. Yeah, everything's fine, sir. Welcome back to India.
Yeah.
Which part of India are you?
It is all the people are from different part. I am from the north, and Dr. A.K. Gupta in the central, in the Calcutta, Delhi itself, capital.
I'm from New Delhi. New Delhi.
And then other people are also from Calcutta and different part of the country. People are joining now.
Oh, good.
This is a national level organization, so we'll have the members from all over the country.
All over the country.
And let me give you the greeting on the Hanuman's birthday and the World Homeopathy Day to all.
Yes. Yes.
We celebrated in UK. I was there in UK to celebrate this World Homeopathy Day at British Parliament in the House of Lords, which was organized by the London College of Homeopathy. It was a nice, Dr. Gary Smith was also there.
Oh, Dr. Smythe was there.
Yeah.
Nice.
Yeah.
Nice. We had Dr. Smythe here in
not in
the US.
Dr. Gupta, now we are going to start the session now. So
sure, sir.
We are 5 minutes.
5 minutes late. Yes. Can you let me share?
Yeah, you can share, sir. You are co-host. You can share yourself. Yeah. Before you start, sir, we will have an introduction session and welcome session, and thereafter. So welcome all in this our second monthly webinar, and I, Dr. M.K. Sahani, welcome you all. And this is our second series of the seminar, and that we have started conducting since last month only. And in this month, we are blessed with Dr. Alex Bekker to be the second speaker for this seminar, and I'm thankful to him for his accepting this session. So before I can say such any words, I will request our secretary, Dr. Sanjeev Kumar Singh, to welcome, and then Dr. A.K. Gupta to make the presentation. So before I request Dr. Sanjeev Kumar Singh to give a welcome address.
Good evening and welcome you all in the second scientific Zoom webinar organized by the Homeopathic Medical Association of India. Our organization, this is one of the largest homeopathic organization in the world. And our Secretary General, Dr. A.K. Gupta, is with us today. And I welcome you all. First of all, I would like to welcome Dr. Alex Bekker. He need not any introduction, but I have to say something about him. He is the editor of world's one of the most oldest journal, the American Journal of Homeopathy. And today he's going to talk about why homeopathy and why not homeopathy. I'm very much sure that it is going to be very interesting, and we all are very excited to learn from you, sir. So welcome you all, welcome you, sir. And I would like to welcome Dr. M.K. Sahani, sir, also, who is the base of this webinar. Dr. Subhas Singh is not with us. He also thought about this webinar and pursued all these things. So I welcome Dr. M.K. Sahani, sir, Dr. A.K. Gupta, sir, and I welcome all the participants who have participated in this webinar. So now it's over to Dr. Alex. You can go through your presentation, sir.
Dr. S. Sanjiv, wait a minute. Before he starts, I request Dr. A.K. Gupta to say a few words, and then Dr. Alex Bekker will say something.
Okay.
Dr. A.K. Gupta, sir, please unmute yourself and you can talk, sir. Dr.
I think
Gupta, you are
we
muted.
muted
You are
him by
muted.
accident.
Unmute yourself, sir. Dr. Gupta, unmute yourself.
I think it's probably, we need to let him know it's on the left-hand corner over there.
There
The
is
mute button.
Dr.
Oh, we lost him.
No, he left. He left. Okay, so
I think he
we'll
has
start,
left.
and meanwhile he joined. Then we will. He will say some few words from his side, and so we start the session. Our secretary, Dr. Sanjiv, told, Dr. Alex Bekker is the editor of the American Journal of Homeopathy, which is one of the oldest journal. And then he was also the president at the American Institute of Homeopathy, and he was also served as the Liga LHMI in the different capacity. And today he's going to talk about why not allopathy. This is very wonderful session, and I think his session will initiate and provoke someone to speak. And he requested me to ask ask the audience to make it a interactive type of the seminars. So after his completion of the speech, we'll have the interactions, and you all are free for, after the speech, you all are free for saying something. So with this, I request Dr. Alex Bekker sir, to start the session now.
Yes, yes. So thank you, Dr. Sahani. It's an honor to be here and to present this topic, because we were discussing what would be the best topic to present, and my feeling is right now we have a lot of challenges, and we wanted to address any issues that we have with our practice with homeopathy, our relationship to regular medicine. So let me give you a little bit more background of so in the US, of course, unlike in India, in the US, if we are we don't have medical colleges that are homeopathic colleges. Any of us who are medical physicians have to go through a regular allopathic training. And after the training, we can get postgraduate training as we choose in homeopathy. So a very different system than in India. So my background, just to give you a sense of my experience with regular medicine, is that I worked as an emergency medicine doctor for about 15 years in rural health clinics. And the reason I mention this is you'll see one of the first things that I will mention is related to my experience as an emergency medicine doctor. And as you said, the American Institute of Homeopathy is the oldest national medical organization in the US, was founded in 1844. One of the first presidents of the American Institute of Homeopathy was Constantine Herring. Dr. Herring came to the US from Germany. He was already a student of Hahnemann, but he was he was sent to Suriname in South America. This is where Dr. Herring first proved I believe it was the first medicine made from snake venom, which was lachesis. He started his proving from the South American snake lachesis. As a matter of fact, that snake is still on display in a museum in Philadelphia, the original snake that Herring used for the proving. And so the history of homeopathy in the US goes back a long time. We won't go through the history. This is just something that I wanted to mention. So what is happened? We'll get an understanding of the basis of regular medicine, the basis of homeopathy. Let us at least discuss a little bit those topics in this short time that we have. So when I worked in the emergency room, I was working in a small town as an emergency medicine doctor. There was a little lady came into the emergency room, and she was having a lot of trouble breathing, a lot of trouble, and she had very low blood pressure when we took it, and a very low heart rate. I think this was many years ago, about 35 to 40 beats per minute. She was showing second-degree heart block on the EKG. Patient was having a lot of trouble with her heart. So regular treatment is, of course, we have to give something in regular medicine we call different kinds of pressor, dopamine, I believe, epinephrine, norepinephrine, all the different medications to raise her blood pressure. We gave atropine trying to raise her heart rate. Nothing was working. Patient was going down. Okay. Downhill. So actually, there will be times when I will ask you if anyone has a suggestion. So you can unmute yourself. What remedy would you give this patient if you were going to give a remedy? That's all we know.
It will be better that they can write it on the chat box, because in
chat.
between.
Okay, tell me.
Yeah.
Okay,
Yeah.
Tell them to write on the chat box, and I will. If you can read it for me, because I'm not sure where, because I'm seeing my presentation.
I'll read you the paper.
Okay. Anybody answer on the chat about the remedy? Any suggestions? Of course, we can. There are lots of remedies we can suggest.
There is a calmia.
Sorry.
Calmia.
Calmia. Yes, a heart remedy. Sure.
Another medicine is Carvoveg.
Carvoveg, of course. Yeah, our regular medicine.
And then Digitalis, Dr. Utpal Paul.
Okay. Very interesting. Okay, very good. So all good suggestions. Of course, we don't have. So remember, I was working in the emergency department, so it's not like I'm taking what we call a complete case here, even an acute case. So these are all very good suggestions. I'll tell you something. So what happened is, this is many years ago, before I knew a lot of homeopathy. I knew a little bit, and I was reading an article by Dr. Tyler, M.L. Tyler, Drug Pictures. So at the end of the article, and the interesting thing is, I finished this article about an hour before the patient came into the emergency room. I never read this article before. In the article, Dr. Tyler says, oh, by the way, we can use regular medications homeopathically if we want to. If you really have to, you can use a regular medication. So okay. So that was about an hour before I came. So I didn't have any homeopathic remedies. I had only maybe a couple of homeopathic remedies with me. I didn't have many. So because I read that, I decided that I need to save this woman's life, because obviously if I didn't give her anything, she would not make it. So basically, if we look at the information that I had, you look at Allen's encyclopedia, you can see, of course, one of the remedies. This is not the only remedy that if I had other homeopathic, digitalis. No, I didn't have digitalis. What did I have? I had the drug Lanoxin, which is made from digitalis. The usual drug was given in IV form. So what I did is I took the 0.125 milligrams of Lanoxin, the drug. It's in liquid. I took and mixed it in about 10 cc's of saline. So I diluted it one time. I shook the syringe after dilution, and then again I took 1 cc out of that. So I made and put it into another 10 cc's of saline, and again so 3 times dilution. So we got 0.000125. We got 3x dilution of the drug. At that time, I didn't know any better, so I took that drug and I gave the patient the IV form. So I gave it IV. So what happened is basically in about 15 minutes, the patient stabilized. The pulse started to come up, blood pressure stabilized, and the patient did well until we transferred her to a bigger hospital about 3 hours later. Okay. So this is the only time I've ever used a regular medicine homeopathically. It worked. Now, this is a little introduction to my talk, because we will be talking about regular medicine as well. Okay. So what are we talking about when we speak of science? The word science means knowledge in Latin. So this is a quote from a philosopher of science, Karl Popper. So he says, all knowledge is mixed with our errors, our prejudices, our dreams, and our hopes. All we can do is grope for the truth, even though it may be beyond our reach. Then we can retain without danger that truth is beyond human authority. And we must retain it. For without this idea, there can be no objective standards of inquiry, no criticism of our hypothesis, no groping for the unknown, and no quest for knowledge. What are we talking about? So we're talking about trying to understand what we're dealing with when we deal with regular medicine. What do we deal with? So actually the term allopathy was coined by Samuel Hahnemann, the original. So when he was talking about homeopathic medicine, homeopathy as a principle of healing, he also wrote about, well, if there's homeopathy, then there is something we can call allopathy, which means that the medicines that treat disease produce effects different from those of the disease itself. So this term allopathy was all right to use in the 19th century. However, what we call regular medicine changed a lot in the late 19th century and 20th century. Big changes, even though it's still allopathic, but the term is not adequate to call this medicine allopathy. So we can say that allopathic or regular medicine is based on 2 principles that developed in the 19th century. There was clinical research, laboratory research, and which of course led to the idea of germs causing disease, and of course later to the development of antibiotics to fight the bacteria that that are causative in disease states. And then later in the later in the 20th century, they developed some a discipline called epidemiology, where you can study populations for certain things. So, for example, if we see what is the occurrence of diabetes in different places, in India as opposed to the US, what are the factors that may influence? For example, one of the when we talk about epidemic diseases, the first vaccines that were given for measles was around 1962. Those vaccines, the MMR vaccine, wasn't until 1962 or 63. I'm not sure exact year. However, the occurrence of measles in the world, by 1960, the rate of measles went down tremendously. So this is the actual occurrence of measles even before the vaccine was given. We could see that there were fewer and fewer cases of measles even before. So this is what we call epidemiological research. So what is a disease according to the definition that is used in regular medicine? So a disease is an impairment of normal state of the living organism or one of its parts that interrupts or modifies vital functions, typically manifested by certain signs, symptoms, and resulting from external factors such as infections, environmental factors, internal factors. We have genetic diseases, and many other causes. The other thing that's important to understand is that what is called a disease is assumed to be the same disease that in a given group of people. This is a very important point because in order to study these diseases, we need to assume that they are what are called homogeneous. They manifest in the same way. To conduct studies, the diseases are assumed to be one entity, and then we can study, and we can discuss this point a little bit later because this is very important according to our understanding of how research takes place in regular medicine. Okay, what do we mean by a drug, especially a regular drug? A drug is a chemical substance, other than a nutrient or essential dietary, and it produces a biological effect. It produces a change in the organism, any change. That production, to modify a pathological state, we can term that that pathology itself is also a disease. Okay. So what is the problem? So we have a system of medicine that is based on the idea that we can modify we have a disease, and the causes of diseases if we determine that a bacterial infection is causing the disease, therefore we use a drug that is used for that bacterial infection. The bacterial infection goes away, we've cured the disease according to our idea of disease. Well, the problem is that we know that diseases are not such simple things. There are many causes, And when research is done on the diseases and the treatment of diseases, new drugs, that research is often very, very inadequate. In other words, we have one problem in doing research in treating what we call disease is that if we say that, let's say we're doing research on let's say measles, and we want to define it as someone is positive for measles. However, first of all, we have problems identifying always that measles is actually the diagnosis. Second of all, each person, each child with measles may have a slightly different manifestation of what we call a disease. And the problem is, in order to really have a reliable treatment for something, we need to first identify that disease is really there. And then we need to have what we call double-blind studies showing that the drug actually does something that the placebo cannot do, which is it causes the disease to go away. What has been the problem in medicine is there's a huge amount of what we call corruption. And if you look at, if you can take the former Marcia Angel, she was a former editor of the New England Journal of Medicine. New England Journal of Medicine is probably the top journal in the world, if not one of the top journals in the world for regular medicine. This journal, she wrote, she started seeing that many of the research articles that were sent to her were flawed. They were not doing them properly. They were also corrupting the results in many different ways. She wrote books on this. If you click on this article, you'll see. What is another problem in regular medicine? It's even when it's practiced according to the standards, there's a huge amount of reactions to the drugs, and drugs are misapplied, causing a lot of death. Another huge problem: psychiatric medications for not only do many of these medications do not work well, but the certain side effects, such as the side effects from what we call the SSRI medications, very common, suicidal and sometimes even homicidal. People are killing themselves, killing other people. So huge problems in the burden of causing disease itself. In other words, you have a therapy that itself becomes a disease cause. So we can go back to the discussion. Of course, there are times when regular medicine is absolutely essential. We can discuss that later in surgery, in many cases where it's very useful. However, what we're discussing right now are the problems. Why are we discussing the problem? Because these are the kind of problems that we can say we don't have. Why not? So the first principle that we have, of course, as all of us know, is that most of our medicines, if not all of them, many of them, are based on what we call pathogenetic trials, which are human pathogenetic trials, or as Hahnemann would call it, provings. Provings being the data which is gathered from testing the drugs on healthy human beings. So Hahnemann was one of the first. He wasn't the first, but he was certainly one of the first to start studying the phenomena of drug reactions on the healthy. So the development of this principle of healing. So this principle that Hahnemann understood, it comes not from an idea, it comes actually from his clinical studies. So each time we actually cure a patient, we are proving that homeopathy principle is working. The principle homeopathy is the principle. Of course, the other principle we have in homeopathy is that the minimum dose necessary to cure. So the key to this is curing. So we're not saying that sometimes we use what we call potencies, sometimes we use higher potencies, sometimes lower. The key is the patient needs to be cured given the particular dose. And the most important, from my perspective, if not, is that we have something we call individualization. What is individualization? It means that each person that is treated is an individual. And the drugs or homeopathic remedies that we use themselves are individualized through provings and through clinical experience. So we do not treat a general case of measles. We treat a particular child in a particular time, in a particular area, with a particular case of measles that is dependent on many factors that will determine how we treat it and what specific remedy we use. So this is one element that is not present in regular medicine. And we can talk about this because this has implications, both positive and negative implications for research in homeopathy, because our research can not be exactly the same as regular medicine. However, it doesn't mean that we cannot do research as well. So how do we establish this scientific validity? Science means knowledge. Scientific validity means that we have been establishing the science of homeopathy since the time Hahnemann started developing the system since 1796. And these facts, what we call, are observable. So we can actually see the effects of homeopathic medicine. We can actually measure, such as measuring in epidemics, the effectiveness. All of this means to validate the principle. By now, we have the successful treatment not only of people, both little people and babies and animals, plants, and even treatment of the soil has been demonstrated. You can treat the soil, and the soil itself will actually respond to homeopathic medicines because the growth of plants after the soil itself is treated actually becomes better. One of our sources is the Homeopathic Research Institute. This is a summary from 2024. They may have a more recent summary of research, but if you go to their website, hri.org, you can certainly find the more recent research on the effectiveness of homeopathy. So the question I ask from you, so given the fact that we have so much science and we can go on with our science as well, we can talk about other aspects of the what we call hormesis, which means the principle of using the fact that small doses stimulate the organism. This is a pharmacological principle. If anybody wants me to send you in the chat, I can send references to research in this particular field, which again shows that homeopathic principles actually work. Why isn't homeopathy more recognized given the fact that there's so much evidence for it? That is my question to you. So if we think about the future of medicine, think about where we need to go with medicine. The way I believe is that what we will need to do is we'll need to work together with regular medicine. There's no such thing as working separately and working against. We have to work together to restore the sick to health, to cure, as it is termed. In the future, I think in India, of course, you have your Ayush ministry that is very important for in India. Those kinds of institutions have to be established more around the world. I would love to see something like this in the US. Hopefully we will have it. So institutions established free of prejudice to investigate what we would call the best forms of treatment for any particular disease, using any system of medicine to help to cure the patient. And as we know right now, we may be entering a time where there'll be many discoveries made that will help us as well. So what I'd like to do is to go back to my other slide. Well, how can I go back? Well, okay. So question about what my question to you is, what should we do? Why is it that we have this problem of we have all the research? What is happening? I would like us to open the discussion for us, and and we can discuss, answer questions. I would prefer if we can, as opposed to chat, if you can raise your hand and we can unmute you. And that would be better if anyone would like to there is a little hand you can use to. Yes.
Anyone who like to speak,
Yes.
he can raise the hand and we will unmute them, or I think for the time being, we will unmute all. Okay.
Yes, that's okay.
So you can talk yourself. So I'm unmuting. No, you can unmute yourself now. Everyone can unmute themselves. Meanwhile, I welcome Dr. Ramji Singh, sir, also who has also joined. He was the national president of our HMI, and just now he has joined. I welcome you, Dr. Ramji Singh, sir. He's the past
Ramji, he's over here. I think he's over here.
Yeah. Who is going to talk now? Please yeah. Start the session now. I think it will be better that Dr. A.K. Gupta should initiate.
Yes.
Dr. Gupta, sir, please unmute yourself and talk. You are not able to. Then anyone can. Yeah, Swami Narayan ji. Can you speak, sir, please? So welcome you, Dr. Swami Narayan. You are very,
yes.
Every time you are writing, and so it will be better that you unmute yourself, sir. Yeah, you can talk, sir.
Yeah,
Dr.
thank
Swami?
you very much. My simple and humble question is, today the world is so complex, and so are the diseases and the health problems. As you rightly said that homeopathy works on human beings, animals, environment, that is soil, and the crops.
Sure.
What are
Yeah.
the examples of integrative medicine from your part of the world? And what are the added advantages of integration of homeopathy with the mainline uh, therapeutics or management of the disease?
Right.
If you can throw some light.
Integrate. So I don't know about India right now, of course. In the US, there's a big movement on exactly that, sir. It's we have a movement for what is called integrative medicine. Another term that is used here in the US is what we call functional medicine. So there are organizations that so a lot of what is called functional medicine is
Unmute हो गया.
sir?
Just wait, sir. Let him
Hello.
complete, and then just wait, sir.
One moment.
You
So
come-
let me
you-
answer. Yeah, let me answer this
Yeah,
question.
then you talk, sir.
Yeah.
Dr. A.K. Gupta, after the Dr. Bekker, you will be talking. Yeah.
Okay,
Yes.
fine.
So we can answer your question, Dr. Gupta. So so integrative medicine in the US is a lot of it is what we would call medicine that is prescriptions of supplements, also the analysis of the patient from the point of view of very, very minute studies that are done to figure out if the patient has certain conditions. And so it's a kind of a what I would call a cutting edge allopathic medicine, really. And some of the integrative medicine doctors know a little bit of homeopathy, some of them. They may know a little bit of other types of therapies, but mostly the integrative medicine field is doctors who are doing a kind of what I would call a super diagnosis of very, very minute kind of diseases which they treat with supplements and so the relation between integrative medicine in the US and homeopathy, we have a little bit of relation with them, but we really the homeopathic community is really not a part of integrative medicine. Because that is not what we do, of course. So I hope I answered your question.
Yeah, thank you.
Yes, sir. Dr. Gupta?
Yeah. Thank you, Dr. Alex. It had been very nice to hear you. And as far as the integrated part of the, medicine is concerned, as you say that in USA, it is not that homeopathy has been used very widely. It's more of the usage of supplements.
Yes.
Supplements, as far as supplements are concerned, they are basically it remains the same. It is not only the medication. Supplements are being used here also in India, and
Sure.
the diseases like, for example, patients of CKD, cancer, or long-standing problem of with they have been on, immunosuppressant also. There also they have been using supplements along with homeopathy. What
Yes, sir.
we are finding very interesting things over in India, and which we are doing in our day-to-day practice. Though we are dealing with cases directly with homeopathy, be it a case of cancer, be it a case of your renal failure or motor neuron disease, or even other kind of diseases also. But where patients have been already on allopathic medicines have been there for many, many years. They've been dependent on those. But those patients have started, not responding to those medicines now. And that very stage, if we intervene with homeopathic medicine, which are constitutional, given at that time, and we are seeing very good results that the same patients start responding to those same medicines which they have stopped. What virtually we are doing with the homeopathy, we are able to increase the immunity level and the responsive level of that particular patient. With that, he is able to restart, having the effect of those medications. And gradually, once the patient has been introduced to homeopathy, the medication, the level of medication, the potencies and the degree of medication gradually have been decreased after the introduction of homeopathy medicine. And in many cases, we have seen the patient have stopped taking allopathy medicine completely. And that's the beauty of the integration along with homeopathy.
Yes,
but,
sir.
But if the people are coming to homeopathy directly, far less number of people would require the procedures and the complication and the hospitalization. But unfortunately, this scenario is not, happening as it should have been. Reasons because there are multi reasons behind that. Either the lobby, the pharmaceutical companies. It's a very multi-trillion industry. Pharma industry is there, which does not let homeopathy thrive as it should be. It's a very unfortunate. What I feel personally, for a doctor, patient's welfare should be our aim, rather than only the therapy, whether I'm doing a homeopathy or allopathy or Ayurveda. And if every doctor starts thinking in this term, that his patient welfare is a top priority, then he should not shun away in taking the help of any other system of medicine, because if the patient is not responding to any so-called treatment, be it anyone, rather than carrying on and making the patient more miserable and suffer, you can introduce any other non-invasive process in medication which are less toxic or non-toxic at all. For example, that homeopathy certainly is the non-toxicity is there and easily comprehensively which can be taken by the patient, and it can go simultaneously. So this is the time when homeopathy should be accepted for its efficacy in this form also, as an individual medicine plus as a complementary medicine, as an alternative medicine also. So it can be used for the welfare of human society in totality. So that I think we all, from our associations and all that, from our authorities, we should work upon this idea to bring this at a forefront. That's what I think.
Yes, sir. Yes, sir. That is exactly correct. We have we have to push homeopathy in all those ways, because of course it is exactly as you said. It is non-toxic, and using homeopathic medicine in many ways is very important. That is exactly correct, sir. And I completely.
And at the same time, I would like to add something more. Like I'm treating a lot of cases with this motor neuron disease and doing research work also on that. And the very unfortunate part is that the moment the patient has been diagnosed with ALS or MND, he's been given that there is no treatment. So this particular statement of the doctor or neurologist or the hospital, that makes such a big trauma to the patient as well as patient's family. And on the top of it, they have only two medication which they've been giving, that is Relutor or Edaravone injection to each and every patient of motor neuron disease once it has
Yes.
been diagnosed. And ever since I've started doing research, and I've found out these patients have been very, very sensitive in nature, and they have got some kind of a mental trauma or in the form of the injustice in their life, which has
Yes.
happened. So
Yeah.
I've been giving medication starting from that, and since we are individualizing each and every patient,
Yes, sir.
hence we are getting better results. At least we are able to slow down the progression of degeneration, which itself is a big achievement. And
Big.
in couple of cases, we have seen the reversal also.
Wonderful.
But the literature which is there and the internet is full of that, there is no treatment available. This
Right.
statement causes a very, very big, damage, and I think it's criminal. I feel it's a
Yes, I
criminal
agree. I agree.
it's on any part. But I think if we raise this question, in this point at a level where we can at least deter them not to say so, the patient's longevity and the quality of life would be much better and safer. That's why my submission is there.
I really 100% agree with you, sir. And especially when you were talking, I think for all of us, whether we are homeopathic physicians or regular physicians, it is of utmost importance to understand. We, of course, as homeopathic doctors, we should understand that the real healing is coming from the patient, and the patient is so anything that will interfere with the healing of the patient, and one of the things that interferes with healing is if you tell the patient you're not going to get better because
Sure.
there's no other. That is a big interference, big obstacle. What Hahnemann would call obstacle to cure.
True.
Yeah, we don't want to introduce more obstacles to the patient. We want to take the obstacles away.
Yeah. True.
Exactly, sir. That's exactly correct. Thank you, sir.
Thank you very much, sir.
Also like to add,
yes, I would like to
that,
hear some more comments, sir.
that recently I was approached for a cancer patient, and the multiple organs metastasis were there, and the patient was on the terminal stage, and she started vomiting, and nothing was getting better with all medications. So they asked me, "Can you do something with the homeopathy?" Then I added on. I didn't interfere the other medications. I only I got on the symptoms and what modalities and everything I got, and I prescribed the medicines, our homeopathic medicines, and within one, I say it is about within a day. It is within 6 hours. The vomiting stopped. Then she
Wonderful.
developed appetite, and she was unable to move. And now it is 1 week of the treatment. She is much better. Much better. I can say that she is now able to talk also and getting
Yes.
relief. So my experience is that we can, in the terminal cases, also we can have a support for making the
Yes.
system at least comfort and palliate the things.
Yes, sir.
I'm not telling that she is going to be cured, and there
Yes.
was no chance to be cured because she has undergone multiple chemotherapy and other radiations therapy, and she just on the deathbed. But the peaceful death is also important.
Of course. Oh, not just important. This, we haven't. Of course, I did not intend my talk to be severely critical, but I one of my big criticisms of regular medicine is the way death is handled. Really, I think 99% of dying people should not be in the hospital. In the US, hospital dying is is the worst type of dying one can do. Completely undignified, completely unnecessary, hugely expensive to the family, and it's completely it is really a very unnecessary and very difficult thing. And if we can help, just like you said, if we can help to relieve the patient and have them die with dignity, that's a huge benefit. So I agree, absolutely. So yeah, and that's true. There's a lot that can be done with homeopathy. There's a lot that can be done with other therapies as well. So we should not neglect them. So as far as so the question I asked, a difficult question, of course, and I think a lot of us don't want to address why is our position, right? The fact is, in India, of course, the position of homeopathy in India is a lot better than in most places in the world. But still, the interesting thing is, why is something like homeopathy, which is a non-toxic form of therapy, why is it a minority therapy? Why is it that right? What are the reasons? That is the interesting thing, right? Because why wouldn't you want to be treated by homeopath if once we know what it is? Somebody sent a
Yeah, Dr. Swaminarayan, I think it will be better that you speak yourself. And
the demand,
because
the demand is there.
Better person to answer these questions. Dr. Swaminarayan, please unmute yourself and you talk, sir. Yeah.
Tell me, sir. Tell me, sir.
Well, if you see the absolute numbers, they would be I think maybe on one side you can put India and the other side you can put the rest of the world.
Right.
Per annum, the number of patients treated in India with homeopathy.
Yeah.
And rest of the world.
Right.
Second thing is still when statistic is something very dicey. So many a times it may be used in our favor also. It may be used to be downplay also. So it's the way we look at it.
Right.
The way evolution of be the healthcare in India, if we see post-independence, we had our own problems of resources.
Right.
Okay. So we had to have a way forward for us that in early part we were dependent on many things, not only medicine, but many other things. Right from the the public health infrastructure, public health experts. So a lot of things were be guided by either the developed world or the WHO, which is a case even today for the developing and underdeveloped countries. Unlike USA, which was, I would say that maybe you were already independent, you were in that phase of industrialization.
Right.
So you had all resources.
Right.
If I'm not correct, or if I'm correct rather, until 1940s or 1945, the highest number of hospitals of homeopathy were in USA.
I'm not sure if the highest, but the hospitals were there until about 1920, 1922. In the medical schools. By 1922, in the US, all the medical schools, homeopathic medical schools, except two, were closed down. In most hospitals, if not all hospitals, by the 1920s, they most of them changed their either changed their name and became regular hospitals. So that's a different history. But so what you're saying, the answer to the fact that like in the US, and I understand in India, of course, using homeopathy was also a economic necessity, because obviously homeopathy is a lot cheaper than regular medicine. So that's true. The US developed, the pharmaceutical industry developed in the 1920s and slowly dominated the Western, not just the US, but the Western world, right? We have domination of the pharmaceutical industry. So that is all true. That is there, but the question, so the question remains that what is it about regular medicine that seems to be so it's, in other words, why is it so it seems to people like this is a big thing and homeopathy is a little thing. That is the truth, isn't it? Right?
So if we go by the statistics, I would not mind saying that homeopathy has been growing consistently over past years.
It
The
has.
number of patients, number of doctors, number of kind of the dispensaries or clinics. So the trend is rising.
Yeah, that is, all of that is very good. I'm very happy. But on the other hand, I will tell you that in the West we have a crisis. We have a crisis in homeopathy. The crisis is both in the US and in Europe. Regular doctors are not actually becoming homeopathic practitioners. So we have a great decrease in the number of medical doctors practicing homeopathy, both in the US and in Europe as well. So it's actually a crisis. Now, does that mean that we don't have practitioners? Yes, there are practitioners, but they're not medical practitioners. So that's of course our problem. But it tells us in other words, these issues we have to face, and so we have to answer this. I don't have an answer. I'm not proposing that I have an answer why. I would say regular medicine is dominant. We're right, because of many factors. The main factor, in my opinion, the first factor is the fact that the science, what we call regular science, most of regular science has been supportive of what we call regular medicine. So regular medicine has used the science of the last 100 years. For good or for bad, only in the last 20 years has homeopathic research, 20 or maybe 20, homeopathic research has began to be really as good, right? We have developed our own research base, and now we have a good basis. But before that, we didn't have it. And so the research
Yeah, I think.
But these are very important factors because if we don't deal with these factors, I think we will not, especially in the West, we certainly will not grow. So we're happy to have you help us as well. That is my point. Any other comments we'd like?
Well, I see that there are members from the education side also, like
yes.
Dr. Nitin Gandhi. And I think you can make a better comment, Dr. Nitin, or anyone else can talk on this. Sanjeev, also you can talk on this issue. Dr. Nitin, Dr. Sanjeev, and all those people who are from the educational side, it will be better that you also. Dr.
Right.
Sanjeev?
So I will, go ahead. Please talk and I will make a comment after you.
Yeah, of course, in India, the situation of homeopathy is quite different from other world, no?
Yes.
Now we have established everything established by the government, support by the government. And nowadays we have, government has decided to establish a Ayush clinic in every government hospitals. And yeah, and in Patna, there is a hospital, Holy Family Hospital. It's one of the oldest hospital. And since 1993, myself and Dr. Sahani is working over there. There is a separate homeopathic department. And we are treating so many, we have seen so many patients. They are taking treatment from the allopathic sides along with the homeopathy. And allopathic doctors are also referring, especially for the treatment of thyroid, especially for the treatment of liver disease. And we are treating them. And we both working together and finding very good result with the help of the homeopathy. So nowadays in India, homeopathy has become a part of life of the people. And after this COVID, government has also recognized the interest of the people, the patient. It has been increased in homeopathy. Yesterday also I got one news was there, 20% increase is there, interest of increase is there in homeopathy. And not because of that it's a cheaper. It's a very, very, I can say it's a good concept that it's a safer, not cheaper, it's a safer. So this is the basic reason. The allopathic medicine, we all know that the what type of the harm is there of the homeopathic allopathic medicines. But in spite of that, they have a great role, especially in the very critical conditions. The patient is hospitalized and in ICU. So at that time, they are definitely they are working very well. But so many cases are there in case of the allergy, skin problem, and so many things are there. So the doctors are also, and today we had a seminar there, and so many politicians, doctors were there, and from the allopathic sides also, one urologist was there, one oncologist was also there, and they were talking about our homeopathic medicine, and they were saying that yes, we use homeopathic medicine. One of the most renowned orthopedic surgeon is here in our city. He used to talk about the same item, especially in the broken bone, no? So he said that I used to prescribe to the patient that with our medicines, you can take these medicines. So in India, it's a quite different situation.
Wonderful. Yeah. So what I was going to say
Dr.
is actually
Gupta wants to. Gupta has
yes, I'm going to get to Dr. But I wanted to quickly say something to Dr. Sanjeev, so do you know the work of Dr. Frass from Austria, F-R-A-S-S? Dr. Frass. So we have a little bit of noise. Dr. Gupta, I think we're getting some noise from you.
Those who are not, kindly keep yourself muted. Kindly keep yourself muted. Those who are not.
So we wanted to. I really would encourage you, if you can replicate Dr. Frass's work using in the ICU and with patients, cancer patients in India, because if that work can be replicated with a multi-center study, that would be a very big accomplishment. And something for you to think about. To mention to Dr. Sanjeev.
Yeah.
If you're able to get the resources for it, that would be a wonderful thing to do.
Okay.
Anyway, and if you have any questions, I can get you in touch with Dr. Frass as well. I have his contact.
Sure. I will go.
Let me know.
I will go through
It will be a wonderful thing for, in other words, I would love to see, because there's so much success now in India, I would love for us to have more of these studies coming from India, which will help us. Really, India can help the whole world at this point.
Sure.
That is. Thank you. Thank you, Dr. Sanjeev.
Good compliment,
Dr.
sir.
Gupta, please.
Dr. Gupta,
Yeah. It was very nice listening everyone. I just wanted to add two, three things more for your kind information. That in 1999, I started my institute that's called the Homeopathy Institute of Homeopathy and Allied Medical Sciences. That was the first ever medical center started by a homeopath, which had an integrated system: allopathy, homeopathy, Ayurveda, acupuncture, and Reiki, all under one roof. And the director of health services came to my clinic. He liked the idea so much, because for me, what I used to say, that every system has got something to offer, but every system has got limitations also. If we understand this very thin line, we can really do wonders and the magic for the patients. So he liked the idea so much, and then it was the first time that Delhi government has opened homeopathic and Ayurvedic dispensaries in all allopathic hospitals. That was the beginning. So in that case, and the another thing is, we have been treating, like Dr. Sanjeev has said, we have been treating a lot of allopathic doctors and their families, and they take their treatment. Sydney, you're a Mishra ko dekh lo. So they've been treating their families also, and they feel very good. But the moment when it comes to talking about their patient, then they have a double standard. Then they say, we don't know if anything goes wrong with homeopathy. So this double standard has to go. But it's not all. There's hardly, we can count on fingertips. There are allopathic doctors, modern medicine, those who openly say that we have done our best. Whatever we could do, there's nothing beyond that we can offer. So you can please try homeopathy or try any other system of medicine, which is a wonderful kind of a gesture of any medical doctor. But
exactly,
and that's what I'm saying. It has got you can count on your fingertips. But the majority of them, those who are being benefited by homeopathy for their family members, but they don't let their patients to go to that. That's a one thing. That's a double standard. And Alex, I want to know something, because you've been asking this. Actually, it was a question from our side. What went wrong in America? Because this is what we've been reading in history and all that. There was a time when America and the United States were full of homeopathic. There used to be homeopathic ambulances also, and homeopathic hospitals also. But what went wrong? What went wrong, and how we can see to this that kind of thing should not happen over here?
Yes. So this is an extremely important question. So I will tell you what happened, actually, because it's not what it looks like. Sometimes one thing, it looks right. Everything has what it looks like on the surface, and then something else is happening, underneath, right? So around 1840s, there was an epidemic in the US. There was an epidemic of cholera. So this was an epidemic that was quite severe, and of course, homeopathy is extremely successful in cholera. So after 1840, homeopathy became very popular in many forms. Something like by 1900, maybe also, I guess very similar to India, maybe about 10%, maybe 15% of doctors in the US around 1900 were using homeopathy. Okay. But here's what happened. What was the problem? The problem was that the teaching of homeopathy, there were many places that began teaching homeopathy badly. So there was the failure began with education. So the education began to be very poor. So there were many of the homeopathic practitioners were not practicing what we call very good homeopathy. So around 1910, when the regular the organization, American Medical Association, which is the regular medical association, when they started looking to basically they were trying to see how they can destroy. That's essentially what they were trying to do. They were trying to destroy everything homeopathic medical colleges, osteopathic medical colleges, chiropractic medical colleges. They were trying to destroy all the other systems that were present in the U.S. So they slowly took accreditation away from the homeopathic medical colleges. And by 1922, as I said, there were only 2 left, and even the ones that were left were actually not teaching that much homeopathy. And when the change happened, a lot of the so-called homeopathic physicians, because they were physicians who graduated, they switched to allopathic medicine. So by 1930, in the U.S., the medical schools were gone, hospitals were gone. There were a few homeopathic physicians left that were very, very good. In fact, if you think of the 20th century, Roberts, H.A. Roberts, C.M. Boger, students of James Tyler Kent, Julia Green, 1920s, Wright Hubbard, Farrington's son, E.A. Farrington's son was Harvey Farrington. Harvey Farrington was also teaching in the 1930s. All of these people, they kept homeopathy alive simply because they were present and they taught a course. In fact, and you have to excuse my pronunciation, from the Dr. Dhawale. Dhawale, I think, is maybe that is L. Dhawale from Mumbai. He was corresponding with Dr. Boger in the 1930s, and he the methodology Boger's, and then Fatak. Fatak took the Fatak repertory, comes from, of course, the Boger's repertory. So they continue to be an influence, but homeopathy was killed in the US for 2 reasons. One is that it was weak. There was a weakness in it. The methodology was weak, actually. And the second was that economics, the Rockefeller Foundation in 1915, they gave $100 million. This was in 1915 or so, $100 million. In 1915, $100 million would be worth billions right now. That was the investment in the drug industry. So the drug industry had huge economic power. The homeopaths were weak, and everything went downhill. I'm not a pessimist, but we never know unless we keep homeopathy strong. The truth is, it can go downhill. And that is the lesson that I think needs to be learned. Anyone with any other comments?
Yeah, I do agree, sir. This the economic power is very important. If we are not generating the revenue, anything can be collapsed. So definitely, it may be a big region over there. Economy is very important, and I think now in India, we are generating revenue. This is the reason behind that the pharmaceuticals company from the homeopathic sites and all know. So this is the reason behind that it is growing. Nowadays it is growing in India. But let's see what will happen in future. I don't know.
There's another one thing which we need to look forward is the lobby. What we need is a very strong lobby which is required in this system to grow. And unfortunately, as I said, those who have been benefited, even they become skeptical when they talk to the other people in a derogatory manner. So that kind of a thing should go. If the people are honest to feel and give their honest opinion, the efficacy and the utility what they have gone through, it would work. But as I said, there are people who do not want to share those same thing what they've been benefited in front of the other people to save their own skin. That's number one. Number two, the economy is because if we see the advertisement part of a pharmaceutical company, one company, it spends in billions of dollars on that, because that cost of that medication is very teeny weeny and the market rates have been given is so high. Same is the case with this, but in homeopathy, first the medicines are so cheaper compared to this modern medication. Then the pharmaceutical companies of homeopathy, they do not come forward in that particular manner because there is another. I am going to bring a topic which becomes very controversial. Reason being, when we use dilutions, the cost of dilutions and the cost of the medication which they produce in the pharmaceutical in the form of dilutions and all that is very minuscule. Their average maximum earning comes from these patents, what they sell. Now, if they don't sell that, they cannot even survive. That's what they have to. That's what their saying is. And if they don't survive, they cannot put any kind of a advertisement or something or like that. So this is a one issue which needs to be tackled if the pharmaceutical companies come forward for the sake of homeopathy, and they start giving some revenue to the media, then only these things would be coming forward. And presently what is happening, the modern medicine people are writing the articles, the paid articles against homeopathy. So, I have tried to raise this point many number of times when the Lancet has written that, give a rejoinder there also with on the media also. But the another aspect is when we talk of an individual or an association, that does not get heard until something from the government or the authorities, they take the initiative. This particular point is required by the ministries. And in India, we have got a Ministry of Ayush. And if we talk about Ayush, homeopathy is at the last. But if you see the kind of things, funds given to homeopathy and the importance given to homeopathy is really bare minimum, which is going mainly on Ayurveda or yoga. So Ayush has become either Ayurveda or yoga. So homeopathy, for like in that particular time of COVID, homeopathy did very good. But the result was what we came out with this advisory booklet. There were only 6 or 8 lines about homeopathy. In all those 8 lines, only medicine was given was arsenic album, and in none of the line arsenic album spellings were correct. Everywhere it was a misspelled arsenic album. Now, if this is the state of affair, then how can we really say that what we are doing is going to go to the right people at the right way? So that's another very big problem. Those people sitting in authorities, they need to take the responsibility, and they need to get out of their own personal reasons of just,
Right.
going about their bosses. They need to look forward for the betterment of homeopathy and homeopath. That's what I feel. I'm sorry to say so, but these are two controversial things which are, very important to be addressed and,
Right.
worked upon.
I think the issues and I agree, of course. The unfortunately many of us including myself, there are people that are very capable politically. I am myself am not a unusually capable person, but politically. But we know what we need to do, of course, is support the people who are capable of doing good political work and give them the right support and put people in place who are capable. And I hate to say it, I hope, Dr. Gupta, you won't be offended. People who are younger than you and me. Because they need, political work needs that kind of, energy and push that young people have, that needs to be there, and they're capable. It's just all of these things, of course, have to be, but really, I have to say that we're very happy as far as looking at India. We're very happy with all the developments, and we would love to support whatever little we can do to support good research, and so that we can all thrive together. Because it is homeopathy is one thing. It is not homeopathy in India and homeopathy in the US. Homeopathy is the same everywhere. Yes.
You are true, sir.
All right.
One thing that, in spite of the popularity that is among the patients and by the government patronage, although we say that we have the patronage from the Ayush Ministry, still I agree with Dr. Gupta. We are on the back foot, and I think the reason is that leadership issue and the person's advocacy for this homeopathy is very poor, and it is our leaders are required to be more do this type of the things, and it is very important that this here we are lacking. Just becoming the yes man, I think it is not going to work at all.
No, we have to really, and like I said, we have to put in place people who have that kind of talent. And politics is a talent. And unfortunately, doctors, certainly myself, very often we don't have that talent, that ability, and we have to always be looking for people who have that capacity to do the politics properly and organize properly, and we can support them. That's the best we can do.
Dr. Alex, one thing that I would like to have from you is you referred one doctor whose work is, you said that it can be replicated in other parts of the world, especially in India.
Dr. Frass.
In my personal capacity, I'm in touch with AAPI from USA, that is Association of American Physicians of Indian Origin.
Oh, okay.
They are in numbers, they are more than 90,000, if I'm correct, in USA itself.
So these are physicians who are homeopathic physicians?
No, they are the regular doctors, medical doctors.
Yes.
But their origin is from India.
Good.
Their ancestors or can be first generation, either they are first generation or second generation, or maybe not third generation, but first and second generation cannot be physicians of Indian origin. And we are planning to take some projects in integrative medicine, which is not otherwise possible within the regulatory framework of USA, but which is
Okay.
very much possible in the regulatory framework of India.
Okay.
So we have not yet kind of be fixed that in what disease or what therapeutic area will be work, what modalities will be there as far as integration of kind of be different kind of be aspects of therapy or pathy is concerned with modern medicine. But if you can share some of the details or if you can connect us,
Yes.
certainly we will see that what can be done as far as those protocols are concerned, if they can be replicated here through our association with API.
Yes, I will certainly be very happy to share and connect you. The other idea that I have, as far as if you will be organizing presentations to this group. So as you know, there's not a lot of the regular physicians in the U.S., of course, also in India, but they're not overly friendly to homeopathy. However, as you know, one of the biggest now issues in medicine is the microbiome issue, the healthy microbiome. So we can do presentations. What we have done at my organization, and especially one of our members, and I can even do presentations on that issue, where we can we can talk about the health of the microbiome, and we can tie that issue, that the health of microbiome, and we can tie that into homeopathy. So that's one kind of presentation that can be done to regular doctors, so that that will catch their interest, as far as talking about microbiome and then talking about homeopathy. As far as the research, I'd be happy to connect you to any of the researchers that I know. Dr. Frass, I met him at the Liga meetings, and I know him personally, and he's Austrian, and I think that type of research, if it can be replicated, the reason I mention it is very impressive to the regular doctors, because it's adjunctive treatment in the ICU or adjunctive treatment in cancer patients, where you can demonstrate not only quality of life improvement, but you can also demonstrate survival rates go up with adjunctive homeopathic treatment. So if you can replicate that kind of study, that's very difficult for anyone to say, oh, that's nothing.
No, certainly we'll be very much looking forward to that, because from API USA, the first project or first concern they've shown is gut microbiome. And currently we from India, our colleagues from Ayurveda, they have a therapy called Basti, through which they have demonstrated in India that gut microbiome can be changed for better. And maybe we'll be working on some protocols to be developed for conducting this. But meanwhile, if we are getting some inputs from yourself, your colleague, that what can be the homeopathic approach, I think maybe we can have a parallel, a small group, control group, to be put on homeopathy also for this study. Of course, these are all kind of be very in a nascent stage, but they are very much willing to kind of be take this forward. And for that matter, our government officials from the ministry, not in their official capacity, but they have said that we'll see that the best possible support they can kind of be lend for this project. So we are hopeful.
It's very important, and it will really, this is the growing one of the biggest areas of research now being done, and it has huge implications for chronic illness, the gut microbiome affecting every system, as we know, not just the gut microbiome, the microbiome itself. So, and it puts homeopathy where homeopathy needs to be, which is actually homeopathy should always be on the leading edge of science. That's where we need to be. We've always been leading edge. This is, we don't need to be behind. No reason.
And another interesting area is EVAS, that is peri-surgical cannot be pre-surgical, and post-surgical cannot be some of the things that through homeopathy and yoga, if we can improve the quality of life, early cannot be if we can reduce the number of days of hospitalization, improve the quality of life, that is also on the cards. And let us see that how fast we can kind of be move in that direction.
Yes, please. So contact me. I'd be happy to chat with you, and we can and help in any way I can.
Certainly. Thank you very much,
sir. Any other questions? I've taken a lot of your time, sirs. I hope I didn't go over too badly my time.
Still, we have some 20 minutes left, so we can.
I'm happy. Yeah, I'm happy
no problem.
to talk. I didn't want to.
Anyone?
take somebody else's time.
Yeah, and, I will send you the Dr. Gupta. I will send you the contact details.
Okay, fine.
Naranji also, I will send you the contact details.
Yeah. So we have. I'm copying the emails from the doctors so that I can have some of their emails from the chat. And you can certainly, if you want, unmute here. And any other questions? And
friends from other people should also say something. Anyone has to ask something, any questions now? Please.
No.
Yeah.
Dr. Utpal.
Dr. Utpal Paul. Yes, please talk, sir.
Okay. One moment, sir. Let me just, one moment. I'm just on the other, let me get away from my other screen. Tell me, sir.
Yes, sir, in USA, I learned from different types of books. Homeopathy was growing in 90s. So now it is, how it is this situation, you are using homeopathy or not? One question to you.
I'm sorry, sir. I don't quite understand the question. Is it being used commonly, is your question?
Yes. Is it you are using there in USA?
How is it being used? So you have, as I mentioned, the medical practitioners are less. However, we have naturopathic doctors who are also medical practitioners. So you have, some of them are using homeopathy full time, and many of them are very good homeopaths. Also, there are now in the US a lot of non-medical homeopathic practitioners who are not people who are licensed healthcare providers. And we do have doctors who have come from India who are practicing in the US. They, of course, in the US, a homeopathic physician from India cannot get a license to practice, but they practice, because they know homeopathy. So we have homeopathic practitioners that are from India practicing, but it's not easy. It's not easy for them to practice because they cannot get, in the US, they cannot get certified and become, they cannot become legal health practitioners. That's the problem in the US for Indian and people from other countries, unfortunately. We do, our organization, the American Institute of Homeopathy, we are starting to have at least members who are doctors who live in India, who live in the US, who are from India. So we will, because we had trouble, because they were not licensed in the US, we had trouble getting them full membership, but we're working on that because of the, it's a little bit difficult from the legal perspective, but we're working on that. So that is the state of homeopathy in the US. Unfortunately, we are not producing as many licensed healthcare professionals who are homeopaths, but we're trying to change that. Also, yearly, we have a conference. Our conference, many of you, of course, are aware of the Homeopathic Research Institute at the HRI conference. Every 2 years, we have a conference every year, but every 2 years we have a research conference in Connecticut. And that is also available online. You don't have to come. And that research conference is similar to the HRI conference. It's a lot cheaper, our conference. We have a lot of the same speakers. And if you have any questions, you can contact me. I think we won't have it any this year, but we'll have one the following year. So we're trying to work on the research aspect in homeopathy.
Thank you, sir. Thank you. Sir, my one more question to Dr. Sahani, sir, or Dr. Ramji, sir. Actually, sir, quackery is there in USA as well as in India. Those who have not get a license, and those who have not institutional degree. So, sir, Sahani, sir, or Ramji Singh, sir, I want to know what are the future course of action on quackery, as because many young students are passing out from different institute, and they are finding difficult to practice because of them. So, what is your suggestion on that case?
Nice questions, Dr. Utpal. Regarding the quackery and unethical works, National Commission and previously our Central Council of Homeopathy, it has prepared a guidelines which has every homeopath has to follow, and their license will be cancelled. And now this regulations has become more strict with the NCH, National Commission for Homeopathy. They have revised that editions and it has become more strict. So provisions are there, but problem is that someone has to come forward to report to the authority about the practice they are practicing, the quackery, or that non-homeopathic systems are being followed. So these things are being done. Someone has to come, but what I feel, nobody dare to come or complain against them. So this is very pity, but they have a lot of fear. Silently they will talk, but they will not reveal on come forward to the forward. So this is important for all. But strict, there are even like cancellation of the license as well as the cancellation. They will have some penalty and fine and restrictions. And now the new policy of the National Commission of Homeopathy in our regulation, you may be knowing that presently the admission are taken by the national entity, that is the National Commission's based examinations, and those who obtain 40% of the mark thereof. Now they will have to also, after completing their course, they have to give us examinations again to get the license. This is new provision has been added since 2021 batch, I think 21 or 22 batch for the students. Now the students admitted in 2021, they will have to pass the exam. And there is also provision to revise the registration. It will not be a permanent registration now. These are the new additions that I am finding it, and I think it is a good. So that the questions that was raised by you, Dr. Utpal, this is very much relevant with these regulations. But up till now, I think no one has been prosecuted, no one has been punished under these regulations. Only the people are there. but every time the commission is making announcement, advertisements are going on.
Thank you, sir. It is actually for those. I question is those who are who did not have license or did not have BHMS degree.
That is also there, sir. See, I will cite a case. There was a practitioner in Bihar, and he didn't have the license, and he was practicing, and nobody complained. But a patient of him was who got some reactions or something, so he complained to the authority in the police. The police people inquired, and they found that this person, they inquired about the license and other things, and nothing happened. Then the case was referred to the board, homeopathic board in Bihar, and the inspections the person was sent there. They found that the person has got no degree or no registration or no degree and nothing else, and he's so punishment was, but somehow or other the matter was subsided or suppressed by the political issue. So this is going to happen, but some actions are being taken. 2 or 3 cases in Patna, Bihar also, I have already, in my knowledge, it is there. So, but someone has to complain, sir, Dr. Utpal, and report, follow it up. This is very important. And this is very difficult also, because you have to be very, you may be threatened by themselves for this person.
Okay, sir. Okay, sir. Thank you, sir. Next question. My next question. Recently on World Homeopathy Day, Delhi main function was there in Delhi. So there is a provision for the practitioner regarding GCP, good certificate of practice, I think. So if you have any information, sir, regarding this, please give me some light.
Unfortunately, I couldn't attend that meeting, so I may not be able to comment. Dr. Gupta, before leaving, you have to wait for and to say the welcome. Only 10 minutes is left, Dr. Gupta. So you wait, please, sir. Only 10 minutes is left now. So don't leave. You have to say a vote of thanks. Dr. Swaminarayan has also left. We have our time is approaching now. I think those who have attended this World Congress, they may be better positions to explain all these things. But I had a talk with the ethical committee, that registration committee chairman, president, presently it is Harpreet Kaur. I talked to her. She was very much organizing the meetings with the different part of the country. She also approached me for the visit to our state, Bihar. So let's see how much we can do in these aspects. Things that government are there, but someone public has to coordinate. This is important. So any more questions? Any comments, sir, for me, Dr. Utpal?
Sir, actually GCP, the 1 month certificate course will be organized by Ayush Ministry, and it will be likely online.
That is, so many courses they are conducting, but they are not meant for the practice. They are not meant for the practice.
No, sir, this is for practitioner only.
Yeah, it is for the practitioner and who are registered practitioner. Yeah,
yes.
It is not meant for the practice. It's just in improving your knowledge. This is continued process. It is going on. Many times they are conducting, and I have also attended many of those seminars like that.
Yes, sir. Yes, sir. Thank you, sir. Thank you.
So, any more? Any more?
Any more questions? If there are no more questions, I
think it will be time to wind up now. So, Dr. Gupta, can you propose a vote of thanks? for this webinar. Dr. Gupta, please unmute yourself.
Yes.
Yeah.
Okay, Dr. Sahani. I must say that it was, thank you, Dr. Alex Bekker. It was a very, very nice interaction. And what had transpired, that what we had been looking for as a question, the same question we've been asked by you. That was the one thing which was something very interesting. And I think ultimately what all of us, we need to understand and think that we must try to do our own analysis, and which should be honest analysis rather than just playing a blame game on anybody or any association or any person. Because ultimately what we believe in India, that ultimately the truth always prevails. So the truth, which is homeopathy, is a science, is a art, and is a system of medicine which is for the welfare of human being. And Dr. Hahnemann, who himself being an allopathic doctor, and has come out with an idea because he was not convinced for the doing of allopathic system of medicine. So कोई बंद खुला हुआ है. So what we all need to work together for the upliftment of homeopathy and homeopaths at large. Though there are certain things which we feel that we have had shortcomings in ourselves also, we need to work it out, and not only on a, because what once we see that we go to Liga meeting, conferences and all that. I've been traveling almost everywhere and attending the conferences. The outcome of those conferences and the publicity or the creativity or the awareness is not being created by any of the country which has been hosting the Liga conference. Whereas if we see that the kind of a work what we've been doing in India, we are doing at least far, far better than what other countries are doing. And we, expect that in the times to come, the overall international bodies, they work harder and take some lead to bring homeopathy in the forefront. As you very rightly said, that it's a job of a youngster or the one who have interest in the politics. But what's said and done, we need to work for the system of our own system and our own welfare. Otherwise, things which have had happened in United States, we don't want that thing should happen in India or any other part of the world. Thank you very much. Thank you, Dr. M.K. Sahani, sir. And everyone, Dr. Sanjeev, I'm so sorry I could not, at peripet time of doing the welcome, I'm doing the vote of thanks. Thank you very much. Thank you.
Thank you, Dr. Gupta.
Thank you, sir. Actually, I will say one thing before I leave. I'm sorry.
Yeah.
I hope nobody's sorry.
Yeah.
I will say one thing that we need to remember, which is what Dr. Gupta was talking about when Hahnemann came up with homeopathy. This is my belief. So the reason that Hahnemann came up with homeopathy, there were a lot of people who could have come up with homeopathy. There were 18th century doctors, Dr. Stork, who knew about homeopathy. My feeling is the reason that Hahnemann was the one, and this may be my personal belief, is that Hahnemann felt very strongly, maybe more than many people, that he wanted to help humanity. He was looking with despair. He was praying to God with despair. God, help me find a system that will not harm people. And that allowed Hahnemann to discover something that no one else had really discovered before. So we need to understand that, I guess in India they understand this, I can say this, but in the West people don't understand that homeopathy is a divine art. It is a sacred art. Yes, so that's what I wanted to finish with.
Sir.
Thank you
Thank you
for
your
having
nice,
me.
Thank you for your time and thank you for all that your thoughts you have shared with us. On behalf of the organizations and on behalf of myself also, I thank you all, and I thank you all those who have participated and shared with their views in this webinar. And with this, we are going to close the session. And we say we say goodbye, we say we'll keep coming to our this meeting. That next meeting will be happening in the 3rd or 4th week of the May. And I think we'll be inviting some eminent persons also again, and they will be sharing. So this is the new things that we have started doing with the homeopathic under the Homeopathic Medical Associations of India. So with this, the session is closed, and I thank you all for participation. Thank you, sir. Thank you all.
Thanks to everyone.
Thank you.